So our next and final segment of this symposium will feature a panel. I think 3 of the panelists are here. If I can invite Emily Lyles, Adam Kushner, and Mark Ohanian to come up and sit in the order I designate. Mark here, closest to me, Emily next, Adam Kushner, who may have baby duties. And the person who's not here but is coming, and maybe in a sense can represent that voice that perhaps is the loudest, but not as loud here, is Noor Shakfeh, who is a Syrian immigrant origin and has also worked in a number of different capacities in Syria. So she will be coming because she's a student here and has an exam tomorrow, I think, in virology. She opted out of coming for the entire time, but she said she would be willing and happy to come at the very end. So I hope she will join us in a few moments, and we'll just take the empty chair. I'm going to do 2 things first and then turn it over to our panelists in the time that we have remaining. I will first introduce them, and I've already asked them in sort of preparatory, in preparing for this, to take 5 minutes to tell us 2 things. First of all, what do they do? Noor? Okay, lovely. So we will introduce you in just a moment, but ask you to talk personally from your experiences, your organization. What are you doing? What have you seen? What's happening on the ground in Syria, in the region? And then if you wouldn't mind, take a moment, and this is the question I will ask each of you. And I think Ann Richard put it very well. Whatever we do, however incremental, matters. So what could we do? What specific step that could be small and local or large and global in terms of advocacy? What would you recommend from your experience, from your organizational perspective, that needs to be done now and could be done by any of us here in this room? So with that, I will introduce our first speaker. I'll actually introduce all of them and then ask you just go one by one. I think we have a timekeeper who will be monitoring your time. Mark Ohanian is Director of Programs for the International Orthodox Christian Charities and responsible for overall management of IOCC's global emergency and development programs, which includes overseeing more than 400 staff on the ground in the Middle East, in particular the organization's response to the Syrian crisis. So they have one of the largest networks of life-saving humanitarian aid inside Syria, and is one of the few international non-governmental organizations working on the ground in 28 offices across the country. He will be followed by Emily Lyles, former MSPH, now currently PhD, a student in international health, who has been based in Beirut, Lebanon, coordinating field implementation of a number of studies from the Johns Hopkins Bloomberg School Public Health Center for Refugee and Disaster Response, including a national survey of healthcare access among Syrian refugees in Lebanon and Jordan. To her left, Adam Kushner, general surgeon and associate in the Department of International Health, and associate with CRDR as well, is a lecturer in surgery at Columbia University and founder of Surgeons Overseas, and has worked as a surgeon and educator in a number of countries: DR Congo, Ethiopia, Haiti, India, Liberia, Malawi, Sierra Leone, South Sudan, and Syria, which is where he will be speaking. And as I said, I think he has a child in the audience somewhere, future health leader. If he has to take that responsibility on, I hope he will certainly allow that. And then finally, last but not least, Noor Shakfeh, an MHS candidate in molecular microbiology and immunology. And in March 2013, she traveled as part of a team into Syria and stayed in the IDP camp, where she assessed camp's infrastructural weaknesses within a public health context, opened a school, consulted on WASH projects, collected data for nutritional and medical needs within the IDP camp, and since her return has volunteered extensively with a number of NGOs, including the Syrian American Medical Society. In short, a typical Johns Hopkins student, and is the daughter of Syrian immigrants. So I will turn it over to you. Just pay attention to time, if you will, and those, again, in the audience. Same rules apply. If you have a comment or question at the end, please let all of our speakers speak. Come to the microphones. If for any reason you can't, we will try to get a microphone to you. So, Mark.
Cool, thank you. Thanks for the invitation first, and appreciate the opportunity to work with you also on Syria and your team from Johns Hopkins University. It's difficult to answer that question. There's one obvious answer for us As a humanitarian organization, as IOCC, we've been working in Syria since 2007, way before the crisis. And then when the humanitarian emergency emerged in early 2012, it really changed our entire work in the country. And it's one that's, it has overwhelmed us, it has overwhelmed the local Red Crescent Society and the few other NGOs that were operating there, including the UN system. Obviously, as a humanitarian organization and as a humanitarian myself, and I'm usually in Syria 3 or 4 or 5 times a year, on average 4 times a year, I have to say that more humanitarian aid is needed. There's no doubt about that, because we're unable to meet all of the needs in the country. We spoke a lot about the numbers, the 12 million, and the large parts of this 12 million, let's say about 18 million that you mentioned, the Syrian population who are in Syria today. We estimate somewhere between 70 and 75% of the 18 million are living in the areas where we are operating, where my organization operates, and that's in 10 governorates in Syria. Syria has 14 governorates. There are 4 that were not present. That's Raqqa, ISIS, Idlib, and Quneitra in the south. Raqqa and Deir ez-Zor are where ISIS has strong presence, as you know, and Idlib, where ISIS and the Nusra Front has pretty strong presence. So these are the areas that we cannot operate, but 70 to 75% of that 18 million live in the areas that we have access to, but unfortunately we are unable to meet their needs. That's a sad reality, that's a sad truth. So of course we would advocate for more assistance first and foremost. Under that comes a very important nuance there, that we should stay, and we've heard that said today, mentioned today a few times, the humanitarian distribution of supplies, we really need to start getting away from those. And we even ask our donors, governments, institutions, also to support for the longer term. We have been doing, as much as these assistance are life-saving assistance to many displaced people, our assistance is a Band-Aid approach by and large. And I think we need to look at the longer term solution, either providing sorts of cash assistance, job creation, and I know it's counterintuitive, job creation in Syria, a country that is at war, but there are ways to do that. We have massive displacements. There are new dynamics being developed in the entire coastal areas of Syria, Latakia, Tartus areas, Homs area. The population grew somewhere from 4 to 6 times, sometimes even bigger than that. So new businesses are emerging in those spaces, but people don't have any revenue. And as such, they are relying on organizations like ourselves, the Red Crescent, the UN and others for the handouts. And I think that's probably one of the worst things that we can do to the Syrians, because they themselves do not want the assistance. They want to be able to generate income, work, and then feed their family. So to keep it short, that's increasing humanitarian assistance, and also focusing on early recovery is probably the top priority. Of course, we're saying this, but we also have to be true with ourselves that humanitarian assistance is not a substitute for a political solution. Let me give you a small example. The first report that I got when the conflict started in early 2012, one of my colleagues from Damascus wrote and said, there's 4,000 IDPs in Damascus areas that we need to have. I remember my colleague, myself, being shocked about that number, the 4,000. And today, since February of 2012, every day, almost every day, we receive displaced people that come to our areas that need assistance. These numbers have not diminished. They're increasing. The humanitarian needs are not diminishing, they're increasing. There's more and more people who are relying on humanitarian aid than any time before, than even yesterday. So these are numbers that they can overwhelm anybody and everybody, and there's no amount of humanitarian money can actually fix the solution. That's why it's important that we put a lot of efforts in finding a political solution, first and foremost. Otherwise, anything else that we do, I'm afraid, it may be continue to be seen as a Band-Aid approach. Thanks.
Thank you. And then Emily?
Thanks, Court. I'm really honored to be here and to have been invited. As Court said, I've been based in Beirut for the past year or so, working on a number of projects, mostly focusing on health access, quality of care, some patient satisfaction work. So I'm really more on the health end, and focused mostly in Lebanon, which I think is kind of a perfect example for looking at global trends in displacement. You have the traditional setting where people move from one country to another, one low-income country to another low-income country, and they're settled in camps, and parallel systems are set up to assist them with health and social needs. And I think more and more you see with Iraq and crises like the Syrian crisis is people are moving into countries where Lebanon, for example, has no formal camps. Everything is informal except for Palestinian camps, of course. And all assistance has been integrated into the Lebanese system. So healthcare is provided through the Lebanese healthcare system and subsidized by UNHCR and a number of other mechanisms. And I think Lebanon is also a perfect example of the complexities of the region, where we're not just looking at, well, there's a Syrian crisis and we now have Syrian refugees, let's deal with that. In Lebanon alone, you have Syrian refugees, Iraqi refugees, Palestinian refugees, and add in migrant workers, which are an enormous problem in a country that geographically is tiny, hosting 4 million Lebanese. A quarter, like Len said, a quarter of the population is now Syrian, and it's just way overburdened, and it's stretched completely thin, and there's no resources for refugees, but also there's not so many resources for host community anymore. So I was, thinking about sustainable solutions, and I think really what needs to happen, which is already happening and we've discussed, is this shift from the Band-Aid emergency response approach of, people are starving, we need to give them food kind of thing, towards development, and really acknowledging the fact that, people have been in these countries working in an emergency setting for years now. At what point is it no longer emergency, and do we try to build sustainable solutions for refugees in the country, for host community, and to pave a way moving forward? If resettlement is not an option, how can we do things best? And so I think the 3 ways that I kind of see that, based on my experience, being most useful is, it would be lovely to say more money. I think more money is always the quick solution, but I think how the money is spent is also really key at this point. And I think by investing in building infrastructure of existing systems, really looking at host countries and strengthening their capacity is essential, and also to focus on host community, because I think you have a large portion of these populations that are now unable to access services because health centers, I've seen time and time again where Syrian refugees are living in large pockets, and the Lebanese that live in that area say, well, I'm not even gonna go to the health clinic anymore because I have to sit for 3 hours to wait. Maybe the doctor can see me, maybe he can't. And so they don't even really try to seek care anymore. And efforts have been made for host communities. I think it should not go without saying that there is money earmarked for vulnerable host community. But I think really looking at the vulnerability within host populations is something that also needs to be considered.
Thank you.
Great. Thanks, Court, and thanks everyone for organizing this. I know it was a lot of work. A couple years ago, I got a call from Doctors Without Borders, MSF, that they had an ongoing project in the north of Syria, just across the Turkish border, and there was an advance by the opposition, and they were expecting a lot of casualties, and they wanted to know if I would go. And so I said, yeah, I did. And 48 hours after I got the call, I crossed the border from Turkey into Syria. I arrived at the hospital that was set up. It had been a converted chicken farm that was functioning as a field hospital. Just as I arrived, about 10 minutes before, a bus had been attacked. There were 40 wounded as I walked in, so I didn't quite get the normal tour and introduction. Went straight to work. There was a team there. There were children that were injured. There were adults. Some died in the emergency department. We were able to operate on a number of them, and we actually did some great surgery and saved some people. And I think, Len highlighted that, and as we talk about the barrel bombs and the 1 million people that are injured and the 200,000 that died, we know about that. What I kind of want to also talk about, though, is also something that I've been trying to do here for the last few years, is integrate the concept of surgery into public health. And what I mean by that is, actually the most common procedure that we did at that hospital was a cesarean section. If you look at the data from MSF that we've started to publish, cesarean section is the most common operation that's done. Paul Spiegel from UNHCR just recently came out with a study in looking at Syrian refugees in Lebanon. 35% of the women are getting cesarean sections. And the issue is they're not getting prenatal care, and WHO says really the level should be about 5 to 15%. And I can tell you, being there, I was not doing elective cesarean sections. These were indicated, needed, emergent operations. And there were also other types of procedures. There were incarcerated hernias. There were conditions from infectious diseases. So that's something that I think is really left out. And we're actually working with some students now to try to get some global estimates of what is the surgical need of refugee populations. And some data starting to come out that really about 5,000 operations per 100,000 population per year is a decent baseline. In the United States, it's about 15,000 per 100,000. So doing some rough estimates, we're saying 60 million refugees are out there. They're gonna need about 3 million operations. And we're not talking fancy things. We're talking children that fall out of a tree that break an arm. We're talking about adults with hernias. Also of note is, as we're doing such a great job in reducing child mortality, children are living longer. Well, 3 to 7% of normal births, children have a hernia that needs to be repaired. These are not getting repaired. I also did some work with MSF in Lebanon and Turkey, looking at the situation, doing assessments. Turkey was doing a great job of taking injured people that we were able to transfer to the border. They were giving them free care, and we were able to trace them through various hospitals. Also, the issue of the refugees going to Europe. One of the things that I worked on with Len and worked on with Gil Burnham when I was here as a student, the issue of landmines. There are minefields in Croatia. So as Hungary closes their border, a lot of these refugees are being forced to move into across fields and landmine-infested areas. And this is in addition to what they face back home with unexploded ordnance, the use of cluster munitions, and of course we do know about the chemical weapons. So I think that's really all. I'll leave it at that, but just to highlight the issue of surgical needs, which we usually don't talk about. Thank you.
Hi, everyone. Thank you for having me. So I would really emphasize what the panel has already said, and I would add that it's really important, I think, to understand what Syrians are aiming for. And while it's excellent to resettle them into different areas of the world and take them in as refugees, I think that a durable solution, a long-term durable solution is the best solution, and that is making Syria safe for Syrians again. And so, as we all know, and which has been reported many, many times, barrel bombs is actually the #1 reason that Syrians leave Syria. And while many do cross into Europe, a lot of Syrians are not willing or interested in taking that risky journey. And so when they end up in the nearby countries, there are a lot of economic constraints that have already been discussed, but there are a lot of population issues that also arise because of the different political parties that are present within each of these countries. And the presence of the economic strain also causes tensions between the refugee population with the host population. So I think advocating to our world leaders to make Syria safe for Syrians, I think, is the number one best thing that we can do. And I think that the second best thing that we can do is to take the time to really understand, why did Syria have a revolution in the first place, and what are the main factors that really caused the revolution? I mean, a lot of people think that Syria was a really great place to live for a very long time because it had, national health care and it had so many great public programs. But I can tell you that as a Syrian American, my parents had an emergency plan for that. If any of us ended up needing medical care, we would actually be taken over into Jordan because that was where we would have our emergency medical care. Because my parents, even though they are Syrian nationals, didn't trust the healthcare system in Syria enough. I think that that's really all I want to say about it, I think. But thank you very much.
Thank you. 2 or 3, I've been getting a signal, 2 or 3 minutes for questions, and then I think we'll ask Mike Clegg to kind of wrap up. So 5 minutes? Oh, we have 5 minutes for questions. Okay, so any other here? Yes.
Yeah, so actually it's not really a question. It's just, first of all, to appreciate all the panelists and all what we've had today. And I speak on behalf of the J.B. Grant Global Health Society and other student societies that have been meeting and are passionate about really seeing that something changes in the Syrian situation. As you can see, some of us are wearing white just as a sign of solidarity with what is happening with the Syrian refugees. And I just want to ask Max, because in the days ahead, we are trying to think of a few practical things, not just by word, but by deed, that we can see how to affect the lives of those Syrian refugees who have resettled in other countries or the ones who are right there in Syria. So practically, we are thinking of doing a fundraising. And we're trying to see how we can work with an organization with, where you're working, Max, because we can't fundraise here in school, and we want to make that happen. And then secondly, we are looking at it from a public health, global public health perspective, in the sense that we want to draft a kind of framework, because we understand that the health systems in those countries where refugees are settled are strained in a way. And we're thinking that as Johns Hopkins, a prominent school of public health, if we students can adopt a kind of framework and encourage medical students in the universities where those resettlements are happening, that they can adopt to, let's say, diagnose and screen for common post-traumatic stress issues and even medical, and in the setting of public health, then that would be a good idea. But we are trying to see how this can happen, and with your ideas and maybe thoughts on that, we could see how best we can do that. So if you can give an input, or maybe even after this panel discussion, you could schedule us so that we can meet and talk more about that, then it'd be a great thing for us. Thank you very much.
Thank you. So maybe since there's not other people coming to the microphone, we can just turn that comment into a question and maybe take a brief moment to talk about what specific ideas can the Hopkins community, particularly but not exclusively students, do? Some tangible next steps that we could take on to keep this focus going forward and to translate words into action. Mark?
I really wish we had a program that we can absorb bright medical students like yourself to help out in this, but unfortunately we don't have such program going on right now. What I would suggest, though, there's a lot of work that's being done with local hospitals, but also local clinics in coordination with the local authorities in places like Lebanon and Jordan and other places. But it's something that would more than happy to talk more with Johns Hopkins University, because we're operating not just in Syria, but also in Jordan and Lebanon, and we can explore ways on this, on how we can find ways in doing more of the good work that you guys are doing in the region. And we have a lot of contacts and connections in those places, and we'll be happy to help if there are opportunities on that. On the other first comment that you mentioned, I appreciate that confidence in supporting our efforts on our response. I just wanted to say that we have been getting a fair amount of support. Of course, not enough compared to the crisis, but I also wanted to add that this crisis for us, at least for my organization, it's not just only for Syria, but it's also Lebanon, Jordan, but also Greece and Serbia now, with the migrants that are there. We have had presence, and we continue to, in the Western Balkans, in Serbia, for instance, and we're responding to the crisis there, but especially more on the 2 of the Greek islands. There are 3 of the Greek islands. There are 4 islands where a lot of the refugees are coming. So 3 of those islands, we're just scaling up our response with our local partners, and we just had, my colleague was there, just got back a couple of days ago, and we're trying to scale up our response there. But on the medical cooperation with the university, with the medical students, that's something I'm happy to discuss more with court and take it further.
Thank you, Mark. Are there others? I don't want to put you on the spot if you don't want to offer an idea. Do we have room for one more question? Or okay, so maybe any other panelists, if you have any specific suggestions. If not, we could ask another.
Well, 2 quick things. I think the Syrian American Medical Society is having an advocacy day on October 9th. So that's one thing. The other thing, I think if we can get more students also to support Len with what he's doing with the Safeguarding Healthcare Worker Project. And for me, it's pretty personal, because when I was in that hospital in Syria, multiple times we had missiles going over the hospital. So it is real, and it is important that we kind of do as much as we can to support the guys out there.
Just to add a little bit more, so when I was in Syria, we worked specifically with the school that was opened, and the school itself actually offered a lot of mental health support for the children in the schools. And school in itself is actually a really great way to help children cope with what's going on, because it creates a sense of normalcy for them after the significant amount of trauma that they've seen and that they've went through. So I would really kind of like take your aim to maybe a school level, some type of activity level, and kind of build it up from there. And I would also consider working with the local civilian councils inside of Syria, because they are recognized by the United States government. And there are a lot of ways to contact them if you need to contact them.
Okay, so this is the last question, so.
So you talked about the needs of Syrians in Syria and in the neighboring countries. For those who have taken the dangerous path and have made it into Europe, what do you think the biggest needs are for these people, and how should Europe help them once they've made it?
Specifically Europe, or
You can
just host
broaden it.
countries? Okay.
Other countries.
So first, I think an acquaintance with the country that they're in is necessary. So often, a lot of Syrians are trying to get to Germany because of its new policy regarding Syrian refugees. Often, Syrians are going to places where their language is not spoken. So they need some level of just acquaintance with the language and the infrastructure. But beyond that, I would also consider small opportunities for income. So I have a friend in Egypt, and she and her friends opened up like a small restaurant, and they basically built it. They built the restaurant, they gave them all the supplies, and then they told them, this is your restaurant, you can manage your restaurant, and whatever money you make goes to you and your families. So I think that having programs like that would really be helpful, because it would give them an opportunity to fund them, to support themselves, and to send their children to school, and then create a sense of stability. Of course, it might not be feasible for governments to open a series of restaurants or something, but I think even doing some something where you can sit with a Syrian family, for example, and then understand the skills that they take with them. Because just to emphasize, most of the Syrians leaving Syria are urban dwellers. They're not people who are uneducated, and they're not people who, have very limited skills. And so to find out their skills and to help them take their skills to their new country, I think would be very effective in giving them a new chance at a life.
I think that might be a good place to stop. So I want to thank the panelists and Ann Richard and Absentia and Len. And this is not the end of a conversation, but the beginning. But to wrap this up, I turn it over to Dean Clegg.
Thanks, Court. I want to thank everybody for a great experience. Everybody in the room and everybody in the live webcast, thank you for being here. And our panelists and speakers, I really appreciate it, especially Ann Richard, who had to leave. For her to take time away from her duties to be here with us was compelling. I think today's discussion helped me understand better the issues and the magnitude of the problem. It's not a comfortable place to be understanding the magnitude of this problem, because it's a huge problem. It's the greatest humanitarian crisis we've ever faced. I'm going to ask them to put a slide up that lists some organizations who are trying to make a difference and can help. Do you have that slide? No, I'm getting nowhere. Okay. So I'll send out an email to people then. Okay. Our job, as I said at the beginning, in the School of Public Health, is really to examine what's going on, the quantitate at a population level, what the issues are, and then to try to present that evidence so that we can create. Well, first of all, we want to give data to policymakers, but to suggest interventions that can help protect human life and save lives. So this was a step for us. I think this is the third conference we've had on Syria. And obviously we need to do more than just have conferences to make a difference. I want to thank everybody who came here today to help us in this quest. So thanks very much.